Is brain tumor medical terminology hard to understand? Imagine trying to learn a new language with words that come from Latin or Greek roots. That's often what understanding brain tumor terminology feels like. These terms are very precise and describe complex ideas about tumor types, brain anatomy, and how tumors grow. Without medical training, many of these words can seem confusing or overwhelming. For example, doctors might talk about glioblastoma, which is a very aggressive type of brain tumor. Or they might mention meningioma, which starts in the protective layers covering the brain called meninges. There are also terms like medulloblastoma, common in children, and necrosis, which means areas of dead tissue within a tumor. Words like mutation refer to changes in the tumor's DNA, and microvascular proliferation describes abnormal growth of tiny blood vessels inside the tumor. These words help describe how tumors behave and what the prognosis might be, but they can be hard to understand without explanation. Understanding where a tumor is located in the brain also involves knowing about brain anatomy. Different parts of the brain control functions like speech, movement, memory, and emotions. When a tumor is near these areas, it can cause specific symptoms. Knowing this adds another layer of specialized vocabulary, making the overall language even more complex. Treatment discussions often include terms related to surgery, radiation, chemotherapy, and genetic factors. These can be confusing if you are not familiar with medical procedures or scientific concepts. That's why many hospitals and clinics provide glossaries or educational resources that explain these words in simple language. Healthcare teams also take time to explain what these terms mean in the context of each patient's situation, helping patients and their families understand their diagnosis and options. In summary, brain tumor medical terminology is naturally complex because it covers detailed aspects of brain structure, tumor biology, and treatment methods. But with good communication and educational support from healthcare professionals, patients can learn these terms and better understand their condition. Remember, everyone's experience with brain tumors is different, so always talk to your medical team for personalized advice and explanations.